This is Dr. Wurzberger. Before we look at some video of arthroscopic surgery, I wanted to give you a perspective of what we would be looking at. In arthroscopy, we see the leaf and not the tree and not the forest. If you look at this picture of a knee joint with the kneecap removed, you can see the end of the femur, the upper end of the tibia, the cartilages in between the bones, and two ligaments crossing in the middle. That's fairly recognizable even if you're not experienced in medicine. This is something that gives a perspective as to what you're looking at. If we were to look at this skeleton with the knee bent over the table and two black dots where the anterior cruciate ligament attaches on the femur and in the tibia, that too gives a good perspective of what we're looking at. Even if you're not experienced in medicine or knee problems, you have a feel for that. Out of the blue, if we showed you this picture, you'd probably have trouble recognizing what you're looking at. These are the two black dots where the anterior cruciate attached, but we've come up so close on it that you don't have a perspective. And that's what I mean, you're looking at the leaf and not the forest. Keep that in mind while watching the video. I'd like to show you what's done when we repair a meniscus. A small number of cartilage tears can actually be repaired. Most of the time we end up taking out a piece of meniscus, but if it can be repaired, that would be the best scenario. One way to repair this is by placing sutures around the edge of the tear through a technique of putting a spinal needle in from the outside in, placing a suture through that, pulling that suture out the front of the knee, tying a small knot on it, we call it a mulberry knot, and pulling it back in to butt up against the meniscus, and then push the meniscus against the tissue that we want it to heal to. This is called an outside-in meniscus repair. We're going to be doing this in this arthroscopic case that you'll be watching, and everything will be magnified and we'll be doing it arthroscopically. But this is the process and the principle. These sutures will dissolve in about 4 to 6 weeks. This is a lateral meniscus repair in a college basketball player. Here's the meniscus sitting out of place, and I take a probe and push it back into where it's supposed to be. So the knee joint was actually locked and he couldn't extend his knee. It's very important to clean out the area in the back where it tore from. The meniscus itself in this case is very normal, and it's only where the attachment is in the back that tore. So if we can get this to heal back into its original position, there's a very good chance that he'd have a normal knee out of it. If we were to remove this, it would be totally inappropriate and doom him to arthritis, and of course shorten his basketball. So we use two different techniques today here. An inside-out technique, which I don't use very much, but also a outside-in technique, which I showed earlier in the video on the model. And those stitches are over on the left of the screen. You can't see them very well, but they're tucked up under the femoral condyle. There they are over there. And now there's some under. Now here is our outside-in technique, where we stick the spinal needle through the cartilage and bring it out through the front, tie a knot on it, and then pull it back down into the knee. And here we are, we're trying to do that. Boom, pop down in, and there's the other one popped in, and now we can tuck those up under, and that really pulls the meniscus back into place and does a nice job of a repair.